Hi, my name is Jason Lau. I'm a third-year student at Samuel Merritt University out in Oakland, California. Today I'm joined by two leaders of the Hand and Upper Extremity Academy.
Hi, I'm Jamie Grigsby, and I am the Vice President of the Hand and Upper Extremity Academy. I live in Westminster, Colorado, and practice in a private practice there for outpatient orthopedics.
And I'm Melissa Lazinski, and I live in Tampa, Florida. I'm the Program Director at the University of South Florida, and I'm the Secretary of the Academy.
Great. So I just want to thank you for joining me for this interview today. I just want to just jump into it. And what kind of advanced skills does this kind of specialty have to offer, I guess, to new students?
Well, I want to start by saying that we're the Hand and Upper Extremity Academy. So it's not just hand exclusive skills. I'm actually not a hand specialist, but I do have a particular interest in the upper quarter, the upper extremity, which is a lot more comprehensive than just orthopedics or just, one particular academy. It kind of crosses a lot of different topic areas.
It's basically a specialty into the upper extremity. Mm-hmm. And so it covers orthopedic, of course, it covers neurological, it covers pediatric, it covers wound care. All of that is encompassed, and you can work in various different settings and then focus more into the upper extremity.
Definitely. So I know in my cohort, we didn't really receive a very in-depth continuation, or I guess deep dive into what physical therapists can do for the hands. I wanted to ask, how would a student really approach this specialty? Is there a way that we can kind of efficiently or just even just jump in and find a mentor and see like, oh, is this something I want to pursue in my career?
Right. So a lot of programs, once you get to the elbow and the wrist and the hand, the content is abbreviated. And so I think a lot of fresh therapists out of school feel uncomfortable treating the hand. That's it. We treat it like any other part of the body. I'm an outpatient, and so you look at the entire kinetic chain. You deal with the joints and the muscles and the tendons and the nerves as you would. If you have interest in building more confidence and gaining skills in that, then seek out that mentorship. Tell your clinic directors, tell your supervisors that I really want to learn this. Is there somebody that I can mentor with, or can you send more patients my way, or what have you?
Yeah.
And then there's also the routes of continuing education. The Hand Academy itself, we have a lot of resources and places to refer people who want to learn more too. So yeah, we're definitely a resource for that, and encouraging physical therapists to not shy away from that part of the body.
So in my education, I'm currently at an acute care hospital, and there's this unspoken rule where occupational therapists take the hands and we as PTs take the legs. Do you have any kind of clinical pearls or insights for students who really want to kind of break and advocate for our profession, that we can also do hand and upper extremity mastery as well?
I think sometimes in the inpatient setting, it can be a little bit more difficult because there are some of these structures in place in terms of how they run the department. And I think that is something that probably isn't something where you're going to make a difference unless you go to the leadership of that department and also collaborate with the OTs and really delineating what are things that are occupational problems that are their special area, and what are things that are just things that physical therapists would be treating just like any other part of the body, just like Jamie said. So I think really that's part of what we need to do as physical therapists that work in those settings, is to go to the leadership and advocate for those things. Because occupational therapists have a very specific skill set that's valuable, but it doesn't mean that they are the only ones who can treat the upper extremity and we only treat the lower extremity.
Very well said. I don't have anything to add.
Okay.
And I guess, so we talked a little bit about resources that the Academy has to offer. And I think as a student, sometimes that can be pretty daunting or intimidating to kind of reach out and it's like, oh, I'm not even a physical therapist yet. Like, should I be using APTA resources like this? But what are some specific things a student can do as far as advocating, like, I want to pursue this specialty, especially in their program?
Get involved. Look for those resources through the APTA, through the Hand and Upper Extremity Academy. Membership for the Academy for students is free. We have a lot of resources on what you can do post-graduation to gain your CHT if that's what you desire, or if you just want to have more experience. For students during their school time, we offer free webinars, and we are also going to be starting quarterly office hour Zoom sessions as well, where you can kind of pick our brains on things.
Yeah, that's definitely cool. And so you mentioned office hours. Are there any other kind of student or programs for students specifically?
We also have opportunities as a student council representative, which you can get more involved in a leadership type position with the Academy.
Got it. So here's the big question that I have is, what can the Academy do for my career as an entry-level clinician? Is it something I'm using to market myself? And I know it's something I'm interested in, I guess, expanding in my practice and gaining more knowledge. But I think there's also a financial component, and I do have student debts that I'd love to pay off.
Yes, I understand that. I think a lot of it comes down to how much you are going to vest into your own furthering as far as investigating what we do have to offer. You can get involved in volunteer positions to be around people who are more specialized in the hand and upper extremity, to find what resources are there, to utilize the webinars even post-graduation. And really it's putting in that time. When you graduate as a generalist in any field, and where you go from there is going to kind of establish your little niche. But there's extra work to be done too.
Absolutely.
And just to add to that, I think that being involved in the academies of the APTA, it's a really helpful way to fast track that a little bit more versus being only connected where you work and only connected with your coworkers and your employer. You're connected with people across the country, and you're connected with people who have similar interests and people that can answer questions and give advice and potentially network with you and introduce you to other like-minded people in your area. So that's one of the things that network is really an important thing. And we're physical therapists, we're friendly, we're helpful. So I think sometimes students maybe have the wrong idea about getting involved. It's we like to be helpful, we like to help each other out, we like to promote the profession. So thinking of it, like Jamie said, as an investment, not just from what I'm gonna learn, but who I'm gonna meet and where that's gonna take me is another way to look at it.
Definitely. Thank you for your time. Thank you for answering all my questions.
You're welcome.
It's a pleasure, thank you.